Well, hello again, everybody. Welcome to the Keep Boone Healthy Facebook channel. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. Today is Thursday, October 8th, and we are joined once again by Watauga County Schools Superintendent, Dr. Scott Elliott, to get a check-in here on the operation of Watauga County Schools now that we are coming down the home stretch of the first week of in-person instruction. A very anticipated time for many children, many families in the area. Dr. Elliott, thanks for joining us again and giving us this update. I guess the first question, an easy one, how's it gone this week? How have you been able to get these kids back in school and begin in-person learning once again?
Yeah, well, it's good to see you, David. Thanks for having me back on the program. And it has been an absolutely exciting week. This week, we started back with our in-person instruction for kindergarten through third grade students on our 2x3 hybrid model that we've talked about quite a bit, 2 days a week on, 3 days a week off. So we've now seen both of our cohorts. We had the first cohort in on Monday and Tuesday, and then Thursday, Friday this week, our second cohort. So today, it's just been absolutely fantastic. And on many levels, first of all, and most importantly, just to see those students coming in the door, in their classrooms, hard at work, happy to be there, and the smiles on their teachers' faces, of course, the smiles on the parents' faces. I was able to be in a few of the car rider lines over the last few days and just talking to parents, and you know, it's been a great experience. It's allowed us to be able to continue to ease back into school by having fewer students in school with us to start out before we bring back more students here in a couple of weeks. But it's also been gratifying just sort of at an operational level. We've put all of these safety precautions into place and all these procedures for screening and cleaning and contact tracing and all of that. And to see those procedures go to work this week and to be taken seriously and to be effective has also has been really positive.
I think anybody that implements things that are printed in a book first and put into practice second knows that there is some certain give and take there in implementing things in an operational reality. Have you found most of the standards that the state put forward have been implementable as they were written, or have you had to do some modifying on the local level here to make things work for Watauga County Schools?
Well, certainly we've taken the guidelines from the state, and those things that are just non-negotiable, you know, we've implemented. But other things that we've needed to adapt, and some of those procedures even look different from school to school. What, you know, I observed in terms of the procedures and the logistics at Bethel School when I visited there on Tuesday were very different than those that I saw at Hardin Park School on Monday. And we've given the schools, the teachers, and the principals the flexibility to implement these procedures in the way that works for them. I think. Also, though, we've had weeks of practice now. Just as a reminder, we've had over 1,000 students coming onto campus for athletics, or our our pre-K students, and our self-contained EC children that have been coming every day. So a lot of the procedures we've been able to slowly sort of work through and refine. You know, some of those are still learning curves for some of our parents, actually. So we had some children who showed up who were exhibiting symptoms that, you know, once they went through the screening procedure, they realized that their children could not come into school. And I think that that's just going to be a continuing learning curve as we experience a cold and flu season and continued allergy season. But everyone has been extremely graceful and flexible and understanding, because everyone wants to work together to keep school safe. This week we implemented all of our full-scale deep cleaning procedures. We have electrostatic sprayers that deep clean and sanitize all of our schools. We at first thought we might get by with 1 or 2 of those in the district, and saw the benefit of them and went ahead and bought one for each individual school. So that's give us a little bit more of a peace of mind about cleaning and sanitation. But, you know, the staff taking on new roles and doing whatever needs to be done to get kids into school this week. I've heard from people today that, like, okay, now it's doable. Now they see that it's possible and doable, and we're ready for the next group of students to come.
You know, you mentioned being able to ease into this. About how many students now does this first cohort or this first group of students bring back to, again, the operational side of things?
We brought back roughly a little over 900 additional students this week. So 460, I have my numbers in front of me as I always do, 463 students in that Monday, Tuesday cohort, 489 students in the Thursday cohort that are with us today, plus the students who had already been coming. So I think we had something like 140 full-time pre-K students and EC students. We also have the day camp program for our employees, like our bus drivers and cafeteria workers and others, so that that they can come back to work and do their jobs. Plus our athletic programs with over 400 students every day, and our career and technical education students doing hands-on labs in nursing and things like that. But our numbers grew by about 900 students this week.
You know, I know we talked at the very onset of all of this about when this eventual time came, a lot of the decision about how to go back to school was going to be as much operational as it was anything else, and making sure that you could run the facility safely and effectively and give the quality educational experience that you strive for daily within the school system. From that perspective, what are your expectations from now moving forward about things like interruption, things that may knock a group off schedule for a little while? Are you seeing those as probably the reality rather than the exception at this point in time?
It is a reality, and we talked about it theoretically a couple of months ago, but now we are seeing it really happening. So, you know, people have asked me what conditions need to exist in order to have school or need to cancel school. And of course, they are probably thinking of local health metrics. And we can talk about that in a minute if you want to, and the concerns that I have and the conditions that we are seeing around the community. But it is also about the health. It's about the health metrics, but it is also about the ability to operate school. And I think now it's occurring to people what I really mean when I say that. Do we have enough substitute teachers to fill in for the teachers who are in isolation or out? What about bus drivers? There's a school system right next door to us who next week likely will be running no buses because all of their bus garage and all of their bus drivers came into contact with someone and have been put into isolation. There is a school system where one school had to close down its entire cafeteria because of the staff there being put into isolation and quarantine. We have some plans in place for some redundancy of staffing, and we've talked a lot about the cross-training and the flexibility of staff and taking on different roles to try to ensure that that doesn't happen. But I continue to remind parents that there might be times, there likely will be times, without a lot of notice when a whole grade level or even a school might need to go back into remote instruction simply because we cannot operate school, not necessarily because it's not safe for people to be there. We've actually been doing a very good job of keeping COVID out of the school so far. But our ability to keep folks in the classrooms is going to be a concern, and the ability to operate schools. I just want to put in a plug. If anyone is looking for a part-time job, or if anyone just wants to help us out in this effort, parents, community members, or others, we are looking for substitute teachers or folks who can sub in our cafeteria, or even folks who might want to sign up as school bus drivers.
And I can only imagine the power of driving a school bus. You got me interested with that one. I might call you down the road.
I'll take you on I have my license. I still drive a bus. I'll take you on a ride one day.
Excellent. Well, you know, you kind of teed this up a bit about, you know, and I know you've talked ad nauseum about this, about how the community behavior really affects the ability for the school system to be able to function at the high level that you would like it to at this point in time. What are the things that concern you about, I'm sure, numbers going up? There's no way around that, or no reason to deny that at this point in time. What does that mean for the operation of school?
Well, it's a challenge, David, and I just want to say that I remain optimistic. We are facing something, and it sounds cliche, but it's still true, unlike anything any of us have ever seen or experienced before. And it has really tested a lot of our systems and protocols and safety nets in our community. But it's also challenged us and caused us to improve and to you know, adapt. That said, you know, what is happening in the community affects our schools. Our schools are part of the community and are integral to it. I think we can rise up and can continue to meet this challenge. We're a strong community. We look out for each other. We can make this happen. But currently, let's be clear, the local current health metrics are headed in the wrong direction. When we made the decision, the Board of Education voted, I think it was 3 weeks ago now, to continue and return on the Plan B for October the 19th, and even to bring our students back a little bit earlier. There was a day when I think that we hit a positivity rate in the high 3%, 3.6 or 3.8, somewhere around there. And even we're bouncing up into the 4%, well below the sort of the safety line of 5%. I think yesterday I checked, we're in the high or mid 9%. Now, when we look a little more deeply into those numbers and our daily conversations with Jen Green in the health department, and looking at the Harvard Global Health Institute and DHHS numbers, which I look at more closely than I look at weather forecasts these days. Yes, we can see that 64% of our cases are among the 18 to 24-year-old population. And let's just say what it is. It's Appalachian State University students. And that's just a wonderful part of our community, but that's what's happening right now. 4% of those who are positive are in our 0 to 17%. And we can see it in the children that are coming to school and the isolations that we've put into place and have for several weeks now, that it hasn't significantly impacted our school-age population. There are positive cases of children and teenagers, and fortunately that we know of, they've recovered and done well. But what's happening in the community among that 18 to 24-year-old and some of the other older age brackets, it obviously affects us. We interact and intersect with each other in so many ways, but there are things that we can control. And I really make a plea, especially to our parents, that if we want to bring our students back to school and continue to have them in school, we need to be mindful of their activities outside of school and how we, have some normalcy to our lives and be able to live our lives in this wonderful community, but safeguard ourselves as well. I'm talking about community activities, and I won't call them out, but just this week we've seen an increase in cases among school age and among our teachers from outside of school activities, large organized community events that, unfortunately aren't taking the safety precautions that need to be taken. I think that we're COVID tired. This is getting old now, and I understand people, kind of letting down their guard a little bit, but now is not the time. So I just repeat myself again. I think I've said this every time that we've spoken. We need to be mindful of what our children and even we as adults are doing, minimizing large groups, wearing our face masks, social distancing, washing our hands, and I've added monitoring for COVID-like symptoms and staying home and getting tested if you think that you have been exposed or have become sick. Those are things that we can do and that we can control. And even though we can talk about the numbers in a little bit if you'd like to, we are seeing cases among school-age children and adults all throughout our community. They're happening outside of school, but as we just discussed, it does affect our ability to operate school.
What do those numbers look like in terms of what we've seen in the case rise? How has that impacted the school system?
Well, first of all, I have to put it, all summer long, I put in a plug for our child nutrition workers and our bus drivers, and they continue to be my heroes. But I'll add to that list our school nurses. And we are fortunate this week that we have hired one additional school nurse. Every school has a school nurse. And now 7 of our 9 schools have full-time nurses in their schools, thanks to some grants from the state and COVID relief money from the state. Our 2 smallest schools still will share a nurse, but they'll still see a nurse every day. Those nurses are keeping a record and case notes of every single adult and every single student that we have a report of a symptom or a sign or a close contact even of someone. I don't have the numbers updated today. They enter these periodically throughout the week into the tracking documents that we have, but I had the numbers somewhere, but earlier this week we were at around 114 staff members and around 135 students where we were doing contact tracing or monitoring, or the school nurses were consulting with them in some way. Earlier this week we had, I believe, 2 active cases among staff and around 4 active cases with our students. I believe those have gone up by a few this week, and again, because of outside of school activities. What's fortunate about that is that the safety procedures that we've put in place have put sort of some safeguards around the school to buffer the school to some extent. Parents and students are increasingly aware of the signs and symptoms. They're monitoring themselves and they're self-isolating. That's been the most important and effective thing. We've done all of the screenings that we do when every single person comes through the front door every day, have caught some of those that turned out not to be positive, but ended up causing the family to seek some medical attention. And also the contact tracing. There are some people who didn't know that they were a close contact to someone who's positive. And once our school nurses have been able to contact them and they then self-isolated for 14 days, sort of ends the chain of that possible spread of the virus. So I do want to brag on people and say how much I appreciate how much people are taking it seriously, and especially when they know that they've been affected by it. I just think that we're also seeing in the community people are letting their guard down a little bit. And I ask people that just to help us out here. And I know they all want our students to be back in school, just to be mindful of those outside of school activities and the safety procedures that need to be put into place.
Final question for you. Any important dates? I know October 19th is the scheduled date for the rest of the group to come back. I know that date is being ticked down in our household. I'm sure many others are like that. But what would you like to kind of put out there on the calendar ahead, so to speak, for folks that need to have those dates in mind?
Well, you've heard me say this in other forums, David. I think that public schools and a system of public education is a bedrock of our democracy. In order to support it and to keep it healthy and thriving, we all need to vote. Regardless of your politics or personal viewpoints, it is an absolute blessing to be able to vote. And I would encourage everyone to get out and vote during the early voting or on election day on November the 3rd. So just as a reminder, 7 of our 9 schools will be used as polling locations on that day. And as a result, the Tuesday group of students who would be coming to school on that day will be back to remote instruction on that day. And in fact, I'll be sharing with our staff members that we will be allowing our teachers and school-based staff to also work remotely that day to sort of clear the way in our facilities for our colleagues with the elections, Board of Elections to come in and use those facilities safely without interruption from our school. Of course, after the polling is over, the voting is over, we'll be doing some very deep cleaning and sanitizing of those facilities on that Tuesday. We won't be having school on that Wednesday anyway, and we'll be ready for school again on the 5th of November. But November 3rd, everyone will be all remote, and encourage you to get out and vote.
Well, excellent. Well, Dr. Elliott, I speak for a lot of folks when I say we appreciate your transparency through this entire process. I know sometimes you've had messages that you haven't wanted to deliver, but feel like you should. And I think that's incredibly important in this process to keep factual information out there. That's what the whole Keep Boone Healthy Facebook channel was created for. And appreciate your willingness to continue to update us on a regular basis and keep people informed about what's going well and where some room for improvement is, not only within the school system, but how people interact with it from the outside as well. So thank you very much for your time again. And we look forward to talking to you again and getting another update very soon.
Thank you, David.
Yay.